I want to start with something a bit more serious. It is Hypertension Awareness Month. Nearly half of adults in the country have high blood pressure. I'm joined by Janet Scoville with Priority Health. Janet, thank you so much for being here with us. We're talking about these new sort of at-home healthcare services that you guys are offering at Priority Health. But before we get to that, Hypertension Awareness Month, for maybe anyone who's not familiar with what hypertension looks like, is how it acts. Walk us through what this condition can entail.
Sure. Hypertension is a fancy way of saying high blood pressure.
Yeah.
And high blood pressure is something that people often have and they may not be aware of it. And that can be really dangerous. It has been called the silent killer because of that. Having uncontrolled hypertension can lead to damage to your blood vessels, to your heart, your kidneys, your brain. And if left unchecked for long enough, it can be deadly and lead to a heart attack or stroke.
I know my dad has high blood pressure. He takes medication for it. It's something that he has to routinely get checked on. And like you said, it's manageable, but it can be very serious, and it is quite common as well. And so you guys are starting this new program called Priority Health at Home, specifically for people who may be dealing with this issue on a more serious level. What is this program all about? Why are you guys beginning it?
Thank you. It's great to have the opportunity to talk about it. So at Priority Health, we are trying to do everything we can to help our members manage their blood pressure. And sometimes having high blood pressure, people can end up in the hospital as a result of that. And so we developed a program in partnership with the Corewell Health Visiting Nurses Association. It's a remote monitoring program that offers members an opportunity to check their numbers, connect with a nurse. There's some in-home visits that can be a part of the program. If you're not tech savvy, the Visiting Nurses Association team can help provide tech support and train you on how to use the technology. It's pretty simple to use.
Yeah, and I think we have a graphic, guys, that we can pull up that kind of spells out everything that you were just talking about, all the sort of different elements that this program includes. And one of the reasons this is so great, and I know you guys started this, is because, one, it can be a transportation issue to get back to the doctor's office, get back to the hospital. Of course, every time, you're going to the doctor, there's also a cost associated with it. So this is hoping to alleviate some of those stressors as well.
Yes, it can do that because the Visiting Nurses Association care team will coordinate with the primary care physician or a specialist if the specialist is involved in managing the medications. So they can provide that medication education and support and help connect to the care team if necessary, many times avoiding an unexpected visit to the doctor.
Who is this program really right for? Anyone who has high blood pressure doesn't necessarily need this program. Who really is this tailored for?
This is for folks who have been struggling to get those numbers down and have maybe tried a few different medications and have ended up in the emergency room or the hospital as a result of uncontrolled high blood pressure.
Gotcha. And as far as location, who is able to take advantage of this right now?
Right now, we're staying focused primarily in West Michigan with the goal of expanding when we learn a little bit more about how the program is performing.
Absolutely. And I know we've got some information. We've got another graphic on if someone is interested or wants to learn more, who they can reach out to. If someone's hearing about this for the first time and they're thinking this might be right for me or maybe a loved one, what should they do next? What's kind of next steps?
Reaching out to the Visiting Nurses Association number or email on the screen is probably the best first step. That person on the other line can do some screening and determine if the program might be a good fit.
And, we were talking about it a moment ago, but as far as cost, use of insurance, things like that, how does this work payment-wise?
For Medicare members, often there's zero cost, but it's always good to double check with your insurance company. So call the number on the back of your ID card is the best step to take to know what your cost share will be.
And that's a great piece of advice anytime you're looking into a new medical service, is to call and say, what does my coverage look like? That way, there's no surprises. Anything that I have not asked or anything we haven't talked about when it comes to this? I guess one question that maybe we should have started from with the beginning is, what prompted this? Was it just sort of ease for patients who are dealing with something that can be serious?
It prompted the fact that it's so prevalent. The prevalence, unfortunately, is what prompted it. So there's a lot of people who struggle with hypertension and who unfortunately end up having to seek care in the emergency room because of it. So it's important to us. It's a way to help keep our members healthy and manage their health and provide a little extra wraparound individualized support.
Awesome. All right. And this is just getting started. So you guys haven't really seen exactly, how it's working just yet or heard from patients, I guess, taking advantage because it's very new.
Is
that accurate? Gotcha.
It's new. Yep.
Yeah.
So we'll learn a little more as we go, and likely we'll be able to scale to the rest of the state.
Yeah.
That's what we're hoping.
Awesome. All right, Janet, thank you so much for walking us through this and walking our viewers through it to really, get a grasp on it. It's something that could be so helpful for people. We really appreciate you being here on Evening Plus. And again, all of that information is available on your website as well if someone is interested, and we'll also be posting this clip online if people need another look at that phone number or that email. Janet, thank you so much for being here.
Thank you
we
for
really
having
appreciate
me.
it.